Good evening, everybody. Thank you for joining us for this week's virtual town hall, sponsored by the Lupus Foundation of America, Georgia chapter, the Georgia Council for Lupus Education Awareness, and Emory University and the Goal Project. Just to remind you that none of the information is supposed to be specific medical advice for you. Please run everything by your medical provider and other sources as well. So these are the total numbers to date as they continue to pile up, and you can see that the overall numbers throughout the world, and then the US being number one in terms of both total infections and active infections, as well as deaths, but also recoveries. And then you see India, Brazil, and Russia, UK, France, Spain, Italy, Turkey, and Germany, rounding it out. Brazil has really rocketed up there, and I'll touch on that in a minute. And one thing that's been fascinating that people have talked about and still don't really know fully is why India has so many cases, but yet relatively few deaths, relative to the number of cases that they have. I mean, they have a little under half of the total infections as the US, but they have much less than half of the deaths that you would expect it if at the same rate. This is the heat map of new infections as of the previous town hall 2 weeks ago. So the darker the red, the higher the number of new cases. You can see where we were. And this is where we are recently. So not too much of a change. This is 2 weeks ago, and this is now. And one thing that will come out again is, as I mentioned just a second ago, about Brazil just becoming much more involved. This is the US in terms of the heat map. Last town hall 2 weeks ago. And this is now. So less in terms of the dark red, which is good. And just looking at it in a different way, if you just see all the colors here, with the darkest red being the most severe risk in terms of new infections. This was 2 weeks ago, and this is how it is now. With New York, New Jersey area still being very high, and our neighbors at South Carolina still being relatively high. Now, as you've all been hearing, the cases have been going down throughout the US, which is great. And you can see it's really gone down a lot. Still at the level of the previous peak, which we thought was extreme. If you remember, there was the initial peak, and then we said it never really went down, went into the second peak. And then we said that that was really bad. And now we've become numb to the numbers, so to speak. But it does tell you how worse we were. And we continue to have a decline in new cases. We continue to have a decline in deaths. And you see that it's come down a lot, although it's kind of going up and down here at the very end. And thankfully, the hospitalizations have gone down significantly as well. So this is Georgia's heat map 2 weeks ago. And this is where it is now. Still some decent areas around the metropolitan Atlanta area, but then you have areas throughout the state, both north and the south, with spotty areas of significant outbreak. But much like the US, the numbers are going down in terms of, these are new cases on the left here, going down quite a bit. And then you can get a sense that the deaths are starting to correlate with the decrease in new cases, as we would expect. And following the trend is the decrease in hospitalizations. Now, we have to worry about areas throughout the world, and that's one of the reminders, actually, every time I do this is that we are in one big community, and the virus shows us that what happens in one part of the world, we're not going to be immune to, literally and figuratively. So this is a battle that we all have to embrace. And when we have countries like Brazil that continue to spout such unscientific and unrational approaches, they are seeing record numbers of deaths, and the spread there is as high as it's ever been. And it's not in large part, it is in large part due to their leadership. They have this president that basically told the Brazilians to stop whining as the deaths were in record numbers. So he continues to spout sort of this unscientific, ignoring type of approach that clearly doesn't work and makes everything worse, not only for the people of Brazil, but the higher number of infections we have, the more chances of variants happening. We already have variants coming out of Brazil that are showing to be highly infectious, and who knows how many more will come out of areas like that if we continue to have high rates of infection. Now, up top is 2 weeks ago in terms of the dashboard, and you have daily new cases were in the red. The infection rate was not so bad. The positive case test rate was below 10%, which is good. The ICU capacity was not very good. And we were at 11% vaccinated 2 weeks ago. And the total, when you sum it all together per their calculations at this website, they had us in the second to highest category 2 weeks ago. And now we've dropped one, which is good. And it shows us that we're doing fairly well in all those parameters. The daily new cases are going down. The infection rate is still below 1. The positive test rate is below 10%, and the ICU capacity is going down, and we're increasing in terms of vaccination. But one point I will underscore now, and it's not to be constantly negative, but it's really to also to put things into perspective, realistic perspective, and to fight against what I suffer from too. It's fatigue. And at some point you get numb to these things, you see improvements, you want to see improvements, and it's easy to slack off. Georgia continues to have one of the highest rates of new cases in the country. I think we're number 4 or 5 in terms of the White House Coronavirus Task Force report. And I didn't really find the article last minute, but I believe we're either the worst state in the country in terms of the rate of vaccinations or the percent of our population who are vaccinated, but certainly in the very bottom tier. So again, it's good to be getting better from where we were, but let's not be happy for being in the middle. We need to continue to be happy with the fact that we're going in the right direction, but I'm not going to be happy until we're in the green and we have high rates of vaccinated individuals so that most of us can be able to live a quote normal life. So news since last town hall, we have a third COVID vaccine from Johnson & Johnson that's been approved for those 18 and older. Merck agrees to help Johnson & Johnson in an unprecedented partnership with rival pharmaceutical companies, and that will just increase the number of vaccines, and that'll have a great impact for those who want it, and we'll talk about that in a second. And the FDA could very well authorize multiple COVID vaccines down the road. There's one called Novavax that has a lot of trial data from Britain, and normally the US FDA, the Food and Drug Administration, likes to have data that is specific to the US, but if they're allowed to submit the British data, which they're thinking about now, then it may be as soon as May before we have the Novavax vaccine. And there are multiple other vaccines that are in development as well. And we have great ones that are already proven, 3 of them in the US that are being more and more available to individuals. So we're sitting in an amazing time to be able to have these to fight against the COVID virus. But obviously, we've talked about in the past, the variants are coming, and they're already here, and they pose a challenge in terms of understanding how our current vaccines are effective against them. And that's all in the works. You may be hearing a lot of different things out there, but we do know that Moderna and Pfizer and Johnson & Johnson have some efficacy against these variants. And there's pretty decent optimism, but it's clear that over time, variants will continue to come out, and there will be some that require us to produce different vaccines against them. But in terms of the South African variant that is clearly out there now and it's spreading throughout the US and the rest of the world, Moderna wants to be very clear as to how their current vaccine is working, as well as an updated vaccine. And they've sent this updated vaccine that was designed for specifically the South African variant to the NIH, the National Institutes of Health. It's the government research agency, to specifically test against the South African variant. And if that tests positive or is shown to be very safe and effective, then this shot may serve to be a booster shot down the road as the South African variant becomes even more dominant throughout the world. And really, this concept of booster and new vaccines is not anything new. We're used to that with other vaccines. We're used to that with the flu shots that some of us, or hopefully most of us in the future, will get. And so Pfizer is testing a booster shot with their new version of their vaccine in response to the variants as well. So they're keeping us on our toes, these variants, but at the same time, we've shown that the scientific community can respond to that as well. So it'll be a back and forth, but we'll, I think we're having some good options out there to help us. So along these lines, these shots are going to be very helpful. They have been helpful, and they continue to become helpful for us. And, the availability is the main thing for most of the US. And President Biden says, based on these new vaccines that are in the works, the third one that's come out, it's producing more and more. Pfizer and Moderna is increasing their production and has committed to increase numbers of vaccine by certain dates. So the White House predicts that by the end of May, everybody in the US who wants a shot from a vaccine maker, you may not get one specifically, but every US adult by the end of May should be able to get access to one. And so that's great. Now, at the same time, we've heard about these states that are taking this good news and really running with it. The governors of Texas, Mississippi, North Dakota, Montana, and Iowa have ended their statewide mask mandates. And you've heard some scientists say that it's premature and unrealistic to think that these actions should be made so early. And some people are reacting as if the pandemic could be over by the end of this year, but that's not the case. I think we're going to make significant headway, but it's going to be a long process. And I've told you this before, not to put a downer on things, but we're getting there. And we're slowly starting to get to a point where things get closer and closer to the way it used to be. This map is to remind us that even though we're hearing about states like Texas ending their mask mandate, we've never had one in Georgia, and a lot of other states haven't had mask mandates either. So, their approach, this mishmash of one state doing one thing and then the state right next to it doing something totally different is, I'm used to it now, but it really is it's kind of weird to think about it from a scientific standpoint, because the virus clearly doesn't care about borders, and with an uncoordinated effort, which is the Achilles heel of what's happening in the US, it's going to continue to be an issue much longer than it should be. But that's the way it is. Now, this is a study from the CDC that, as states loosen things, as you hear about the news of the new cases going down, I just want to remind you to not forget the expertise that you have accrued over these past months, and that you are experts. You are experts in the immune system. You've had to be because of your lupus. And being as resilient as many of you are, you've taken this new knowledge of how the virus works, and you've protected yourself very well as a whole. And it's good to go into this phase of vaccines, and you're going to hear about how, I think the CDC has already sent out guidance about, once people are vaccinated or fully vaccinated, so 2 weeks or so after their last vaccination, they're considered fully vaccinated. You can, if you've been exposed to somebody who has COVID, you don't have to go into quarantine. And I hear that pretty soon the CDC may come out with guidance that if people are fully vaccinated, they can be in small groups without masks. So, these things will start to evolve, and you'll get a strong sense of how things are changing, and you should find great strength in that. But also to understand that when outside of those situations, how the virus works now. You've been equipped with this knowledge that this is a respiratory virus. It goes through droplets in the air. So when people wear masks in public, when you're in an environment that the air doesn't circulate very well, when you're indoors with poor circulation, when you increase the number of people breathing in that area, when you're doing activities that require you to breathe harder, and things come out of your mouth, singing, talking, eating. So, those things we keep talking about over and over, and it cold. So it's no surprise that in counties where masks are required, cases go down, and where in counties where states allowed on-site or indoor restaurant eating, the cases and deaths go up. This, I'm not trying to make a statement about the laws. The politicians will do what they're going to do. But we know as a community exactly how COVID works now. And whether you get vaccinated or not, you know how best to protect yourself. And even if you do get vaccinated, when you're out in public, you need to do these, you need to have this protection in place. But that doesn't mean that you can't do anything. So we know that in big public open spaces, you should be okay if you're distanced. I mean, we used to be afraid of just kind of being close to somebody within 5-10 feet outdoors, but the chances of somebody being, a decent distance away outdoors, where a little droplet from your mouth is going to be scattered in this infinite space around you outdoors. And what is the chance of that going to that other person and have enough virus in there to go deep into the lungs and really spread? I mean, that's very, very small. So, and, it shouldn't be a surprise based on all of this, again, that, here's another outbreak that the CDC reported. These are people in an indoor high intensity fitness class. So, I mean, it's everything that we've been talking about. You're indoors, you're breathing hard, you're close to people, you're going to get a breakout. And here, I think it was like 50 or 60% of the people over this week in this facility that a lot of people were not protecting themselves very well, and high risk environment. Yeah, that's right. 68% developed COVID-19. So it's back to basics, and the vaccines will change things a bit and improve things over time. As more and more people get vaccinated, then restrictions will loosen up. But along the way, when you're in a scenario where you just don't know, you know how to protect yourself. So we're just going to finish up with some questions here. I combined these two because they basically ask about what the lupus vaccine, the COVID vaccine does to people with lupus. The top one, I'm sorry, I can't really go into, the background, your specific background is so important to you, but I can't really address that. We don't have that information yet, let alone some of the general information. But the general question is a very good one. Will the vaccine trigger or intensify a flare-up because it's asking our already overactive immune system to work more? That's a good question. It's generally not a good idea to get vaccines when your lupus is very overactive. And so that's been true in the past for the flu shot and other things. So it should pretty much hold for COVID too. So it's not the ideal time. I didn't say it's absolutely not the right time, but it would be a good idea to talk to your doctors about this. We generally would like to wait until your lupus flare, if it's a bad one, gets under pretty decent control for at least a week or two, and minimize some of your medications that might interfere with the vaccine response if you were to get it, and then do it at that point. Are there any particular studies related to lupus patients yet, or is that just years down the road? There are particular studies underway now, including one being led nationally at Emory with Dr. Sands. And that hopes to address some of the questions related to things like this. What does the COVID vaccine do to people in lupus? And it may depend on the type of vaccine. We just don't have any answers yet. Now, whether it's going to be years down the road, I don't know exactly when, but I do know they're fighting hard to do it very quickly. And everybody knows that this isn't something that we can wait years on. And think of how quickly the vaccine came about. So I know these people are working extremely hard. I've sat in on the meetings trying to set up the studies here at Emory and throughout the country. And I can tell you that they're working very, very hard on it. So I'll keep you up to date as soon as I hear of anything. And I want you to do the same to me and the community here. And this is why we have our COVID town halls. This is why we have the LFA chapter, is that we have power in numbers and we're going to help each other out. But help is on the way. Guidance is on the way, probably not as fast as we want it, but it'll be here. Why are people having such severe reactions to the second Moderna vaccine? My arm was so swollen with a rash and a fever for days. So I'm sorry you had that. And it is not uncommon. The majority of people don't have these severe reactions, by the way. I just want to make that clear. But I forget the exact number, but something like 20, 30, 40% may have some that are mild to moderately severe. And so just going back to a slide that we talked about before, what you're describing right after the shot, usually within 1 to 4 days or so after having the shot. And as you mentioned in your question, it tends to happen after the second shot for these 2-shot vaccines. I happen to have this reactogenicity is the term that they're using for this. After the first shot, that was more severe than the second, but I was the exception to the rule. And you're right, usually after the second one, many people can get different degrees of these symptoms. And they can be significant enough not to go to the hospital, but to really kind of make you feel blah. And I couldn't do work for like I said, the whole afternoon, and I just didn't feel like doing anything. I just kind of sat in bed. And what these reactions, or this reactogenic response is the immune system being revved up in an appropriate way. And what's also what defines these reactogenic symptoms is that as quickly as they come on, and as severe as they can be in some people, they go away as quickly, and people go back to their baseline self, just as fast. So as badly as I felt, and as badly as many people have felt, after 1, 2, or 3 days or so on average, they go right back to where they were before. What I also tell people is that the most effective vaccines tend to have these reactions because they are appropriately triggering the immune system to respond that way. And if you don't have any of these symptoms, don't be alarmed. It means that you're lucky. But if you do have these symptoms, I tell people that it's a nice reminder that your vaccine's working. And you may even have a better immune response than people that have absolutely no symptoms at all. Both of you are, as far as we know, well protected. So again, no one should feel superior, or the other person shouldn't feel more worried. But I do know that when you do feel these symptoms, it does mean that your immune system is really being primed, and that's a good thing. So these adverse events that are medically important, that bring people to the hospital, are extremely rare. And what's even more something that I'm even more confident in terms of saying is that, a lot of these issues are out there in the internet in terms of people being concerned about associations with vaccines, and that's not true. So some of you who are concerned about ADHD or narcolepsy or anything on here, and there have been a lot of reports on the internet about having these associated with vaccines, they have never ever been proven true. That's not to say people have not gotten this after having a vaccine, but that's far from saying that the vaccines caused it. And as hard as they've looked at throughout the literature, there's no proof at all, not even close, that any of these conditions are a direct result of the vaccines in general, including the COVID vaccine. Now, there's some questions that people have that come up pretty frequently that one of my colleagues at an Emory faculty, who's often at Grady, Carlos Del Rio, he's an international expert, infectious disease expert in COVID, and he's published this article in a scientific journal, JAMA, the Journal of American Medical Association. And he has some answers. It's a 1-page or 2-page report, and it's a little scientific, but I think it's an easy read. And so here's the link to that. You guys can go back and maybe Terry can post it up later. I'm sorry, I thought I had it copied so I can put it in the chat, but I don't. What categories of COVID vaccinations would someone with, this is pulmonary arterial hypertension and lupus, get? And are there any advocacy efforts to help us get vaccinated? So there's no, I just told you that we don't have definitive studies to even tell us whether COVID vaccines trigger lupus in some people. So we certainly are not going to get to the point, are at the point now to know what type of lupus or what issues you have. You should get this vaccine or another. But what's clearly out there as more and more vaccines come out is that don't look at the different numbers in terms of efficacy. What all of these vaccines show is that they have a strong protection against hospitalization and death, which is the most important thing. And you shouldn't wait to try to get your favorite vaccine or what you prefer to get, because you need to get protected sooner rather than later. And as supplies ramp up, you may be tempted to kind of wait because you heard Moderna is better or Pfizer is better, and you just don't have it available at the time, but maybe it will be next week. We're just not there yet. So, I would ask you, if you are open to getting the vaccines, to please go for the one that's available the fastest, because there is clearly no evidence to lean one way or the other. And by the way, if there was something behind how it's made, how it works, that theoretically, or even maybe some early data shows that it's better or potentially better in lupus, I would bring it up to you. I probably would still encourage you to get the one that is available, because it means that you're protected in some way sooner rather than later. But there isn't any evidence to show that you should kind of wait for something because you have this or that or this type of lupus, or you're on that medication. Go for what you can get. And in terms of, I'll get to the advocacy in a second, but in terms of when you'll be able to get it, right now we're in phase 1A+, which are these groups down here, as most of us probably know, in Georgia. Now, beginning tomorrow, they're expanding the eligibility group to educators and school staff, adults with intellectual and developmental disabilities, and their caregivers, and parents of children with complex medical conditions. I can tell you at Grady, we've been instructed not to dig into detail as to these things. I think if people honestly say that they fit one of these categories at Grady and probably a lot of other facilities, you should be able to get it. The other thing to note, that as I mentioned earlier, is President Biden is saying that we're going to get vaccine to every adult in the US who wants it by the end of May. And that's really close. Now, exactly, is that going to be true at the end of May? Is it going to be earlier? It's going to be a little bit later. It'll be around then. And so we're really close. So you can see that there's a lot of phases between here and maybe where you fit or might fit. But, if it was like a month or two ago, it may seem like forever to get to where you are. But with all the news that we've just talked about earlier, we're clearly on track to have the vaccine available for most people in the US very, very soon. So you will get there somewhere before the wide open phase of phase 4, just having lupus. I think it's phase 3 or phase 2, but it should be in the next couple of months, no question. But that doesn't mean we don't need advocacy. And on that note, there clearly is a need for a lot of advocacy in this area, but in lupus in general. And we have a powerful forces in Georgia. And so I'm going to ask Terry to talk. Just give me 1 second here.
Okay. Thank you, Sam. Thank you for that segue into talking about advocacy with lupus. We also received a great question in the chat about talking about pain and inflammation and new medications. That's one of the reasons we advocate. We advocate at the national level for new medications, for research, for dollars to go towards funding to find out who has lupus and find out the incidence and prevalence. And Sam, Dr. Lim is involved in that with the Georgia Lupus Registry at Emory University. But we just went to the Hill on Thursday, 164 people strong from Georgia. We usually go up to DC physically, and we have about maybe 10 advocates. Because we did it virtually, we were able to engage over 100 advocates in meetings with their legislators last Thursday, which was an amazing accomplishment. They got to hear about what our needs are, and our needs are for more funding from the CDC, for the Lupus Registry, for the NIH, for the Department of Defense. We need more research. We need dollars to flow in there. And that's where we can make a difference and make our voice heard. So we want to take that momentum and translate that into what we're doing here in Georgia. And in Georgia, as Dr. Lim said, we've got forces down at the Gold Dome in Kim Schofield, Representative Kim Schofield, and Representative Bonnie Rich, and many more. Because some of them sit on a council called the Georgia Council of Lupus Education and Awareness. And they're working hard every day to make sure that our needs are met and that legislation concerning lupus, anything to do with healthcare, how does that affect somebody living with lupus? But we have to do our part. So on March the 11th, we have to go virtually this year to the Capitol. Last year we went down there, about 75 of us went down there in the cold pouring rain and turned the Gold Dome purple. And when I say we turned the Gold Dome purple, almost every elected official wore a purple cape on Lupus Awareness Day, and they're doing the same on Thursday, on March 11th. And we plan to get another photo of that. It's an awesome, awesome show of support for lupus constituents. So on Thursday, March the 11th, we are doing the first part of 3 in a series for our Lupus Advocacy series, which has to be virtual this year. We have to do that for safety concerns, and we're not allowed to go down to the Capitol and advocate now. So we're going to do a town hall with Bonnie Rich, who is a representative in North Georgia, and her sister has lupus. So she's very involved in what we do. She's part of our lupus collaborative. And then Kim Schofield, who's a representative and just our fierce, fierce fighter down at the Georgia State Dome. Kim is living with lupus, and she is everything lupus, and she advocates for us on a regular basis. So I'd like to encourage you all to sign up and join us. We're about 50 strong right now. We'd love to get to 100. We'd love to get 100 people joining in and showing our voice and showing them how much it means to us. So the second session is going to be on March the 18th, and that's going to be with the lobbyists, telling us why we advocate. Why is it important? Why is it important to bring these concerns to the Hill? And why is it important to bring these concerns to our elected officials at the state and local level? And finally, the third installation on March the 25th is going to be about telling your story. How do you communicate your story? How lupus affects you on your worst day? How do you tell your legislator about that? If they don't understand what you're going through, if you walk through their door and tell them everything is fine, they're going to say, why do we need to make any changes? You need to let them know what you've lost because of lupus. And that doesn't mean you're not a survivor and a warrior, but you have to tell them the path that you have taken to get to where you are at, and it's important. So I urge you all to register at lupusga.org. Please stay in touch with the programs that we're doing. Like I said, Lois asked a great question about lupus medications and pain management. We've got a whole series of education programs coming up, including a summit in May and an education series in the summer that are going to touch on a lot of these topics. This coming Wednesday, we have a program on lupus and hair loss. All these programs can be found on our website at lupusga.org. So Dr. Lim, thank you for giving me time.
No, thank you, Terry. I mean, this is just amazing. As you can see, we're so blessed, and we're leading the way in many ways in the country in terms of this outreach, the community that we have. What we have is truly special, and we thank you for a lot of that, Terry, and especially also for Representatives Rich and Schofield. So continue to check out the website, the lupusga.org website as well. Their COVID resources, the national resources at the LFA website. Keep sending your questions to info@lfaga.org. And know that starting next month, we're moving, effective now actually, we're moving this COVID town hall to the second Sunday of each month because of so much expanded programming that's available and that will be available, as Terry had mentioned. You're going to have lots of other opportunities to be engaged. Now, don't worry, we're not going anywhere in terms of our COVID information, but we will pack it into the second Sunday of every month, and just look out for that. And I look forward to seeing you in next month. But until then, please stay safe and send us your questions, and keep taking one step at a time, because we're going to get there together.